Good afternoon everyone. Myself Ms. Waghmare Nayan. I am clinical instructor at the Dr. Vittalrao Vikhe Patil Foundation College of Nursing. Today we're gonna see the topic called E.C.T. So to begin with, I would love to give you a short introduction like how E.C.T came. So in the first, when E.C.T was not there, okay, so there was a procedure called insulin therapy, okay, which generally used as a unique treatment. But after few trial and error, the researchers come to know that insulin therapy has many side effects, okay, so that's why they had just stopped that practice. And then in 1938 Benny and Serletti introduced the E.C.T technique, okay, which is today we known for a somatic type of treatment for a psychiatric illness. So let's just see one by one. So first, electroconvulsive therapy, it is a procedure in which electric current are passed through the brain, intentionally trigger a brief seizure. Okay, so in another word, let's just say that it is nothing but a artificial induction of the shock wave to the brain, so that it can clear or it can make a specific changes in certain neurotransmitter. Next, in history, you can make notes of it. So in 1785, the therapeutic use of seizure induction was documented in the London Medical Journal. Convulsive therapy was introduced in 1934 by the Hungarian neuropsychiatrist Lidilas J. Medulla. Next, in Italy, so there is an Italian professor of neuropsychiatry Ugo Serletti and his colleague Linceo Beni in 1937 experimented E.C.T for the first time on the person. Through the 1940s and 1950s, the use of E.C.T became widespread and it is considered as a unique treatment for the electroconvulsive therapy. Next, we'll see the definition. This is according to R. Shrivani. You can see as per the book, there are various of definition, but the standardized one considered from the R. Shrivani. So, electroconvulsive therapy, formerly known as a electroshock, is a psychiatric treatment in which seizures are electrically induced in anesthetized patient for the therapeutic effect. Okay, later we're gonna see there are basically two types. Okay, E.C.T is the modified type, okay, where patient is first anesthetized and then the induction of artificial shock wave were given to the patient. Next, there are few indications. These are few major, as we can see: major severe depression, then severe catatonia, severe psychosis. Also, this severe psychosis include postpartum psychosis. Then come your schizophrenia and mania. In schizophrenia also we can see there is a postpartum schizophrenia, okay, in which the pregnant women, okay, after she deliver a child, this type of schizophrenia occur where she felt that the child was not belonging to her and she tried to kill that child. Okay, it's just a part of paranoid schizophrenia, let's just assume. Next, mechanism of action. Okay, as we know that there is no specific action mechanism is stated yet regarding the E.C.T. Like there is a one hypothesis which state that E.C.T possibly affect the catecholamine pathway between the diencephalon and the limbic system, also involving hypothalamus. Okay, these are the particular part of the brain which are generally involved whenever we induce the E.C.T to the brain. Furthermore, there are technique. Okay, basically there are two techniques: direct technique and modified one. Okay, so this direct technique is nothing but the modified version of E.C.T, where we give patient anesthetic drug and muscle relaxant drug. That is called is a indirect. Okay, and in direct we didn't give any muscle relaxant or anesthesia to patient. We directly apply electric wave to the patient. Then there is also two type of electrode. Okay, first is a unilateral and second is a bilateral. Okay, so unilateral is nothing but at the one side of brain is only given to the shock, and in bilateral the both side. Okay, it has particular position. We'll see in next slide. So you can see here in unilateral the one electrode is placed between the outer ear canthus and outer lateral eye canthus midpoint. Okay, that is nothing but your temporal and frontal bones mid part. Okay, that is one electrode we place over there, and another is at the parietal junction. Okay, which we know which is at the center of our brain, or we consider it as a diamond diagram something. Okay, in pediatric we consider it. So that is the part where we place another electrode when we used to give unilateral type of E.C.T. Then come your then come your bilateral bilateral direction. Okay, so this bilateral position you can see both the electrode were placed at the point of the inner and outer canthus of the eye and ear, which is nothing but your temporal junction of your frontal and temporal bone. Next, we can see drugs which are generally used for E.C.T. So in that, first is the atropine, which is 0.6 mg per kg per body weight we gave. Then in administration of anesthetic agent like propofol, that is 0.75 to 2.5 mg per kg, and thiopentol, that is 2 to 5 mg per kg. Then also we can see in muscle relaxant. In muscle relaxant, the most common we use, okay, even in a clinical practice nowadays, they use succinylcholine, that is 0.5 to 1.5 mg per kg. Next, then there are some contraindication. Contraindication indicate the situation where we cannot give E.C.T. So that it also again divided in two. First is the absolute and second is the relevant. Okay, absolute is like is a situation or like condition where you can't. Okay, though even though it's prescribed by doctor or like psychiatrist, you can't give. That is increase ICP. ICP is nothing but the increase in intracranial pressure. Okay, whenever patient goes under eye surgery or any head trauma, or like any patient is came in contact with the violence, okay, either self-directed or other directed, that time the raise of ICP will be definitely there in their clinical diagnosis. Okay, so in that situation we suppose not to give E.C.T. to that patient. Then come your relative. Okay, relative means some medical surgical related condition or like any other condition related to human body. Okay, so first is recent MI. Okay, myocardial infarction. If any patient is above, let's just consider 40 or 60 and in between, and he get myocardial infarction recently, so we cannot give them E.C.T. Then come your severe hypertension. Then come your cardiovascular accidents, and lastly there is a retinal detachment. Okay, as I mentioned earlier, whenever any patient go under any eye surgery or any accident, okay, that time you can see this condition clearly. Next, that is a side effect. Okay, these are few I enlisted, so let's just see one by one. First is the effects on memory. The acute effects on E.C.T. can be included amnesia. Okay, it is actually a temporary one, it is not the permanent one, as we modify E.C.T. Okay, in direct E.C.T. we used to see temporary permanent memory loss, not temporary. Okay, temporary we can see here in modified one. Then come side effect of the general anesthesia. In general anesthesia you can see drowsiness, okay, confusion, okay, this or letharginess. Okay, these are the common let's just say side effect we can see here. Furthermore, there is a confusion which is also related to general anesthesia and other sign and symptom. Okay, in other we can see if proper mouth gag was not placed, okay, or proper tie up was not there, or if any metal was remain in patient only before the procedure, so we can see because of that we can see cyanosis. Okay, we can see burn, even though tongue bites. Okay, these are very common stuff we can observe. Next, nursing care in the E.C.T. Okay, so this is very short. So first, that is a provide educational and emotional support. Okay, as we know, there is a principle of psychiatry, provide subtle and subtle explanation as per the understanding level of the patient. Okay, so these go under here. Then come pre-treatment planning and assessment. This actually come under the pre-roll, during roll and E.C.T roll. Okay, so pre-roll, whatever it is requirement, like informed consent was there. Okay, then preparation of that patient. Okay, that all thing come under this. Next, preparing and monitoring the patient during the actual procedure. This is go under the during the care, nursing care at the time of E.C.T. Okay, where we have to observe. Okay, tonic phase, clonic phase, then what time, what the duration of that particular seizure. Okay, is there any associated complication? Okay, these things we have to observe during this in this point. Then come post treatment and care and evaluation. So post treatment care and evaluation, it involved after the E.C.T. what kind of complaint patient objectively tell you. Okay, and you are subjectively observing in the patient. Let's just see one by one. So first, that is a providing educational and emotional support. Okay, it includes explaining the procedure to the patient at the level of his understanding. Then come informed consent, which should be there in the local language which client communicate. Then come respond to the patient concern and feeling. Okay, if the patient is having any query, we supposed to solve it. Okay, or we give it an adequate explanation to it. Then come educate the patient concerning the procedure. Okay, if is there any hazardous thing or the thing that will cause damage to the patient, we should explain it to the patient. Then come initiate the education intervention based on knowledge deficient. Okay, move further. That is pre-treatment nursing care. Okay, this pre-treatment nursing care, I would love to simply explain. This is very short. In brief, if we see, so first and the most important, that is a vital sign we check. Okay, then we go for the informed consent. Okay, then come for the preparation of NBM. Okay, we kept patient kneel by oral or kneel per oral. Okay, in which we kept patient empty stomach from midnight 12 p.m. to the next day of E.C.T. We even stop their medication also. Okay, then we check whether the patient had applied any nail polish, okay, or any ornament were there. We ask patient to remove it. Okay, then come we patient history, medical history, past history. Okay, as we learn in indication, sorry, as we learn in contraindication that there were many medical surgical condition. If those are present, we cannot give E.C.T to the client. Then come your patient orthopedic osteoporosis, we check. Okay, whether they were having any extra limb, okay, artificial limb, what we call. Okay, if those were there, we supposed to remove it. Okay, and even patient are having, those who are having pacemaker, in those patient also we did not allow give them to E.C.T. Okay, otherwise it will contraindicate with the E.C.T and it will nicely cause burn to the patient. Okay, to avoid such a condition or no harm to the patient, we do pre-examination, and also we prepare for the electroencephalograph. Okay, which is the same like a E.C.T, but in electroencephalogram we check the wave activities of the brain. Next, that is the during care. Okay, in during care we transfer patient on a trolley from waiting room to the E.C.T room with a well padded bed. Then we apply ECG electrode, BP curve, pulse oximeter, then give a short action anesthetic agent and succinylcholine and prepare EEG electrode. Okay, here a few things are missing which I would like to explain. Okay, while we are giving patient, while we are transferring patient from waiting room to procedure room, that time we supposed to place the electrode, mouth gag. Okay, which was made of foam. Okay, so that prevent tongue bite. Okay, or any inner mucosa damage. Okay, while we provide E.C.T to the patient. Also, when we give E.C.T, here we actually observe tonic and clonic type of seizure. Okay, so tonic seizure which will last from 10 seconds to 30 seconds. Okay, and the clonic we observe that is from 30 to 60 seconds in patient. Okay, like how patient is reacting. Okay, move further. That is last post E.C.T care. Here we to begin with, we shift patient from E.C.T room to post room. Okay, after posting, we literally observe and record all vital parameter. Before that, we allow client to have a rest, okay, for 30 minutes. Okay, why? Because client is already empty stomach and he might feel drowsy or exhausted. That's why we allow client to sleep for 15 minutes, 15 to 30 minutes. Then come place the patient on the side lateral position and clean the secretion. Why we place client on side lateral? Because we had administered client during E.C.T anesthetic and muscle relaxant, due to which there are lots of respiratory muscle which get paralyzed, because of which client may not able to breathe properly, and because of secretion he might suffocate or choke, due to which death may take place. That's why we always turn patient on side lateral position whenever we shift patient to post-operative room. Then come allow patient to have tea or any drink, as the client was starving since he was NBMs last midnight. Then record any procedure, okay, which we call data recording, okay, according to various hospital. Okay, there are various procedures for there, and here I would like to conclude the E.C.T. Okay, E.C.T is nothing but the somatic type of treatment which we generally administer to treat the psychiatric illness, and it has basically two type of placement of electrode, that is unilateral and bilateral. Then come that the dimension, okay, there are few parameter I would love to state. In parameter, the ECG should be given at the duration of 0.5 to 0.7 second. Then E.C.T, okay, E.C.T has the two types of seizure, that is a tonic phase and clonic phase. Okay, and here I would love to conclude my topic. Thank you.